Hi, this is Jessica DeMassa, and I'm here at HIC 2017 in the HISA Studio, and I'm here with Matthew Holt. Matthew, please introduce yourself for everybody watching.
I'm Matthew Holt. I am the co-chair of Health 2.0 based in San Francisco, California. I also own the healthcare blog, and this interview may end up there. You never know.
It may end up there. It will definitely end up there. So Matthew, you were here speaking about SMAC Health, and so I want to hear a little bit more about that. So for those who missed your presentation, talk about this, because this is something you've been talking about for quite a while now.
A little bit of time. So SMAC Health, SMAC, stands for Social and Sensors, Mobile Operating Systems, Analytic Tools, and the Cloud. And these are the new underpinning technologies, infrastructure of all the stuff we use every day, like Facebook, Twitter, Gmail, all that stuff, right? Now, I added a K for kindness, because in healthcare we want to be empathetic and want to be kind. And I like the term SMAC Health because it's more precise about the new kinds of tools we're using in healthcare rather than the rather more amorphous term digital health, which, you know, we have a lot of stuff going in healthcare. It's enterprise technology that lives on the client server, lives in the basement of hospitals. It's digital, but it's not, to my mind, modern the way that SMAC Health is. So that's the term SMAC Health. And I've been trying to do a little subversive movement of changing the terminology that people are using. I'm losing so far, but I'm trying hard.
Why do you think that changing the language would help? I mean, is it a paradigm shift in thinking that needs to go along with that then?
Well, yeah. Now, by the way, if you know about paradigm shifts, the concept was invented by a guy called Thomas Kuhn. He said that for a paradigm to shift, everybody who believed the old thing had to die. So I'm not sure that everyone has to die, but I don't want people to interpret traditional health IT as being the same as what we talk about in Health 2.0, which is the idea behind SMAC Health. I want people to realize that there is a new and different technology that can do things in a different and better way than the rather clunky sort of green screen plus infrastructure that you have now in enterprise health IT. We had a lot this morning about, you know, back in the 90s, 80s and 90s in Queensland, using green screen architecture and yet steadily moving to enterprise systems, mostly dominated by big American companies like Epic and Cerner and Allscripts. But even those guys are starting to open up, and they're starting to build app stores. They're starting to incorporate other technologies like built by developers into their systems. Very similar to the way that Apple does, or Google on the Play Store does, or Salesforce does with its app exchange. So that's the idea about SMAC Health. Can you bring that new technology in and basically, essentially funnel out and hollow out some of that enterprise stuff and move the technology from the basement of the hospital out to the cloud?
Do you feel like that's like a democratizing of health technology then, in a way, if we're bringing in all these outside companies and these consumer-focused companies?
For sure. The idea is you can build tools much more quickly, much more easily, and also have them be available to clinicians, more of a choice, rather than having to use, you know, one or two sort of lay down the law applications, which the law has been laid down by people higher up. So I think it's making it much more like the typical consumer market we understand. Now, there'll be definitely winners and losers. There are only a few apps of any type that get used in the App Store and the Google Play Store. So I don't expect it to be that there'll be thousands of apps used. But what I do think will happen is that you'll see more development more quickly and the ability to move to more effective and better solutions more quickly if we get to that world in which we have a cloud-based underpinning a series of app stores and better user experiences.
So I know you're from San Francisco, and you're obviously very familiar with the American healthcare system, and I know you've been spending some time studying here in Australia, what's going on here. And so tell me a little bit about what you see as some of the similarities or differences. Are the challenges the same here in Australia as they are in the US, or are they different? What are you seeing as some of the differences and the similarities?
Big picture, the challenges across healthcare systems are the same everywhere. How do we get newly informed and empowered consumers to work in the system? Because don't forget, really before the 70s and 80s, consumers knew nothing about their health. And with the growth of the internet and the growth of information, they're much more engaged and empowered than they were before. And that's the challenge for all healthcare systems. The other challenge, which the Australians share with everyone else in the world, is how do you connect primary care with specialty care in hospitals? Because that technological gap between those two has been very, very hard to deal with. And in most countries, and Australia is no exception, you've got primary care networks which are sort of organized in one way, and hospitals and specialists which are organized in another, and they really talk to them, they don't talk well to each other. That's pretty true in Australia, it's pretty true in the UK. The same thing is basically true with a much messier way in the US. So I think those areas of similarity are true. The difference in Australia is got a much more state-dominated system than you have in the US. Or I'll rephrase that. The US is different because of the vast amount of private activity and cash-based payment compared to everywhere else, whereas in Australia and most of the rest of the world, you have a much bigger role for government payment. But you do have a pretty thriving private sector here. About 40% of the population has got private insurance. So, you know, you could argue backwards and forwards as to how different it really is. But nonetheless, I do think that you've got the opportunity to do great stuff in all different systems using new technology.
So talk to me a little bit, last thing for you, about the startup community here, because I know, throughout the rest of the world, it seems like there's a big movement, and it is a digital health kind of driven trend, that there's a lot of startups in that space that are trying
SMAC
to...
health driven trend, you mean, Jessica?
SMAC health driven trend, Matthew. That SMAC digital health trend. That it seems to be pushing that community forward. And so are you seeing anything here? I mean, I know with Health 2.0, talk to me a little bit about some of the startups that you're seeing or not seeing here in Australia. What's the climate like here for that?
So I think all across the world, smart kids with computers are building solutions that look roughly similar but are adapted to their local market. And we've seen this at Health 2.0. We go to Japan, we go to Europe, we go to the Nordic countries, go across Asia, India, and there are people doing that in Australia. The difference are regional, and they're based on population and based on money. If you live in San Francisco or Silicon Valley, you have access to almost, not quite, but almost unlimited amounts of venture capital, a massive entrepreneurial spirit. And in some ways, we're all frustrated that we haven't changed the healthcare system as much as we could do. With all that, the billions in dollars, on the way to $5 billion this year, going into venture capital in healthcare. A lot of it happening also in India and China, and a certain amount happening in Europe. I think Australia, in comparison, only has, it's only about the size of California in terms of population, and it certainly doesn't have the active venture capital community that you see all across the US and now in Asia as well. So it's a little harder for people to get off the dial. But I've seen a number of companies just here in the exhibit hall who've got cloud-based services which are either avatars for coaching or community sites, what have you, which are now selling to primary care networks here, selling to hospitals. And pretty soon when they get a little bit further up the curve, they'll be coming to the US and trying to sell their stuff there as well. So I think there is, good hope for the Australian health tech community. It's just, it's going to be slower, and it's not got the critical mass you'd expect to see, but that's a function of population, money, and to some extent distance.
Right. Well, Matthew, thank you so much for joining us. Any final words? I'm going to regret asking that, I think.
It's a pleasure being here. I love coming to Australia, and lovely to see you here, Jessica.
Thank you so much, Matthew.
But come back to America soon.
Thank you, I will. Hopefully at the beginning of October. So I'm Jessica DeMassa reporting from HIC 2017 in the HISA studio. Thank you so much. Thank you.